Lagos, the commercial nerve center of Nigeria, has over the years continued to expand in terms of population and settlements. As the Lagos state government embarks on the transformation of Lagos into a mega city, the ever-increasing population of Lagos has continued to put pressure on basic infrastructure such as healthcare facilities. In recognition of the need to make healthcare available, accessible, and affordable to the generality of people living in the state, Lagos state government has built standard healthcare facilities in all the local government areas of the state. These efforts include rebuilding and equipping the State Teaching Hospital in Ikeja, general hospitals, and lately the ongoing revitalization of 57 flagship primary healthcare centers by the State Primary Healthcare Board. These primary healthcare centers are spread in such a way that almost every urban and rural community has a health facility nearby to cater for the healthcare needs of the people.
The community serves both Igbari, Ibukunolu, Anoluwapo, Bajulayi, and then some people even from Bariga area, also Ilaje also comes to this place, and we attend to every one of them. Far to Community Road of Lagos University.
The huge resources invested by the Lagos state government, coupled with the free primary healthcare services being provided for pregnant women and children by the State Ministry of Health, has continued to encourage many families to access the healthcare facilities in their various communities.
We give them total care when it comes to, when we are talking of that maternal and child health care. This starts from as soon as they have first contact with us that they are pregnant. What we do to them is that we give them forms to go to any of the laboratory very close to their street or nearest to their house to do certain tests, such as their PCV check, their blood group, their genotype, as well as other necessary tests as needed in order to assist us to cater for them.
Despite the commendable efforts of the Lagos state government in bringing health care to the doorstep of the people, there are still some communities where the people go through so much trouble just to access healthcare services. One of such communities is the Agoigun community in Bariga, a suburb of Lagos.
I went on outreaches. I visited the Bale with the chiefs. The efforts to make the women come to utilize the health facility was good.
Agoigun is a waterfront community situated in Shomolu local government area of Lagos State. It is predominantly a fishing community with migrants from Badagry, a border town in Lagos State. A sharp contrast from the affluence of their neighbors in Yaba and Bagada areas of the state, Agoigun is home to the poor of the poor. This is where we came across Mrs. Madelenu Kukoyi Akpofo, a petty trader and a mother of three.
My name is Kukolu Madelenu Akpofo. I met my husband in Badagry. We have been married now for 15 years. When we got here, I started selling bread, tea, noodles, and eggs. I only added a core recently. I have given birth to 3 children. My first child is 5 years old. My last child is 5 weeks old. My husband is a fisherman. He sells fish to women in the neighborhood, who in turn roast and sell to consumers. You see, there are some illnesses or medical complications that women may have during child delivery that local midwives may not be able to handle. Since I lost one of my children to ill health, which could have been avoided, I decided to start attending the health center. That is why I delivered my last child at the health center. When my pregnancy was 3 months, I registered at the Olubadare Health Center and attended the antenatal clinic there. Because of the distance and my poor economic status, sometimes I trek to the hospital, and when I have some cash, I do take commercial motorcycle to the hospital. When I was to deliver, I had to go all the way to Akoka Primary Health Center because the health center at Olubadari does not operate 24 hours. Most times, I find it difficult to pay for transport to the hospital and for some of the drugs. My husband does not earn much money from his fish trade. We are just struggling to feed the children and ourselves. Money is a challenge for us. I thank the government for all they have done and for the health center that they have provided. The only problem is that we find it difficult to transport ourselves to the hospital. The only way to get to the hospital is by commercial transport or by foot. The distance from here is about 2 kilometers. It is very tiring for a pregnant woman to walk long distances to the hospital. If any of us has any medical emergency at night, we are always afraid to go out because of attacks from street urchins. We would like the government to establish another health center close to our community.
The access to basic primary health care is a challenge for women living in this community because it is far and on the average expensive for their standards. They do appreciate the fact that certain complications could arise for a pregnant woman at the point of delivery that would necessitate the attention of appropriate medical service providers. Also, the timely treatment of their children when they are ill and delivery of various immunization vaccines to them in health clinics remain the community's dream. However, for this to happen, all hands must be on deck.
Now, there is inadequate personnel, the provision of more equipments. The first thing is the personnel, because for us to manage effectively, we have to provide the materials like functioning borehole, and they should run pipe-borne water into the premises.
There must be more investment in the health sector, targeting the underserved communities that will bring health services to the doorstep of the likes of Kukoi, who wish to but are unable to access health services. This is their prayer. Eko ni bàjẹ́ o.